Great. Hi, everyone. Thank you for joining us for today's Strengthening Families webinar. We are very happy to have you here to learn about the updated standards of quality for family strengthening and support programs and how that relates to helping families build their protective factors. I'm going to introduce a little bit of the context of these webinars, and then we'll get to our topic very quickly. So we do this usually every month. We actually haven't done one in a couple months because of other meetings that were happening, but we do this typically every month. It's an open invitation to anyone who's using protective factors in their work, coordinating strengthening families efforts, or just curious to learn more. We jointly convene these between my organization, the Center for the Study of Social Policy, and the Children's Trust Fund Alliance. And each month we coordinate a topic, usually with guest speakers, and we welcome suggestions about other topics and speakers we should include in this series. The recordings and materials from the past webinars are all posted at a Google site that is maintained by the Children's Trust Fund Alliance. So if you miss one, feel free to peruse that site and find the one you missed, or just look through what previous topics have been. And this one, the content will be posted probably tomorrow, definitely by Monday. So feel free to look there or share those with folks who missed the webinar itself. As I said, we do this each month, always the second Thursday of the month. Sometimes it's an hour, sometimes it's an hour and a half. Today we're doing the 90-minute webinar with more interaction. Next month will be more of a standard 1 hour, primarily presentation with Q&A. That will be focused on concrete support at the federal level and everything you need to know about the American Rescue Plan and the Child Tax Credit, and the work going on to advocate for that to be made permanent, to make sure it reaches the families that need it the most. That's in May. We will have second Thursday of the month webinars going forward, so you can just mark those mark those dates on your calendar, and then as they come up, we announce the topic and you can decide if it's one you want to register for. So for today, we are focusing on the updated standards of quality for family strengthening and support. We'll hear first from Andrew Russo and Julie Matusik from the National Family Support Network. Andrew is the co-founder and director of the NFSN, and Julie is the membership and administration coordinator. And they will be sharing the standards themselves and some of the work that went into updating them recently. And then we'll learn about how folks are implementing the standards in 2 different states. We'll hear from Chris Watkins in New York, who is a Family Resource Center director and a member of the National Family Support Network. And then we'll hear from Debbie Comstock, Barb Levitt, and Donette DeMaio, all from Utah, who are all involved in implementing the protective factors and the standards of quality in Utah. And I realized I was going to say everyone's formal title, and I dropped those away. But everyone is part of the National Family Support Network, doing this work in family support, and active implementers and trainers on these various frameworks and tools. We'll have some time for Q&A, and then we'll send you out into breakout rooms. And for the last 10 minutes or so, we will share some updates from CSSP and from the Children's Trust Fund Alliance. So that's our plan for today. And with that, I'm going to hand off to Julie, who's actually going to share her screen, and Julie and Andrew will be presenting. I might need to stop sharing. Oh, there we go.
All right, well, we're so glad that you're to have the opportunity to share with you today about these national standards. And so thank you very much, Kaylin, for this opportunity. Again, my name is Andrew Russo, co-founder and director of the National Family Support Network, and I'm here with...
Hello, I'm Julie Matusik, and I'm the membership and administration manager with the NFSN. Great to see you all.
And Julie's in upstate New York, and I'm in Washington, D.C. And the National Family Support Network, as you'll see on the next slide, is a membership-based organization. I think we're getting some
background noise there. Sorry, if you're not the current presenter, please mute yourself, and I will try to mute anyone where we hear noise coming. Thank you.
All right, so the National Family Support Network is a membership-based organization that is comprised of state networks of family resource centers. When we first started in 2011, which is hard to believe was 10 years ago, there were just 8 states that were colored in green on this map. So now we've more than quadrupled in size over the last 10 years to now 31 member networks, 32 member networks, 31 states plus DC. So if you happen to be from a state that isn't yet colored in green on this map, we'd love to talk with you. Next slide. And the mission of the National Family Support Network is twofold. It's to promote positive outcomes for all children, families, and communities by leveraging the collective impact of those state networks of family resource centers, as well as championing quality family support and strengthening practices and policies. So our vision is that that whole map would be green, that all families would be able to access quality family support and strengthening services in their communities through family resource centers that are supported by strong networks. So as mentioned, this is the same agenda Kaylin went over with you, that we'll be talking about the background of the standards, the overview of the standards, and then hear implementation examples from both the program level and the systems level, then time for question and answers, and then there'll be breakout groups where you can choose to explore what you'd like to know further about the standards in general, talking with people who are implementing at the program level or talking with people who are implementing them at the systems level. So we hope there's something for everyone in this presentation. Right, so first, some context as to the origin of the standards, where the standards came from. So the California Network of Family Strengthening Networks developed the standards of quality for family strengthening and support in 2012. And then these standards almost immediately thereafter were adopted nationally by the NFSN for national implementation in 2013. And then 7 years later, the National Network engaged in a comprehensive review and revision of those standards, working with our member network representatives across the country, parent leaders, and representatives of family support programs in Canada as well. So through this revision process, we had a particular focus on ensuring that the standards would work in both the US and the Canadian context, and that they would reflect a focus on diversity, equity, and inclusion, which is now infused throughout the standards. And that new version was approved by the National Network in February of this year and formally debuted just last month. Next slide. The importance of these standards is that they help ensure that families are supported and strengthened through quality practice. So as long as we're going to be working with families, we want to ensure that we're working with them in the best possible ways. And another beauty of the standards is that they create a common language across different kinds of family strengthening programs and different geographic areas. So whether you're working with families in a home visiting program or early childhood program, or with families in the schools or at a family resource center, these standards can be used, we would say, and would have value for anyone working with families. So they're used by family resource centers, but they're not only used by family resource centers. They can be used by anyone working with families and create that common language across different programs and geographic areas. And they're designed to be used by all stakeholders. So that includes public and private funders, by the community-based organizations providing the services, and families themselves as a tool for planning, providing, and assessing quality practice. Why we're sharing all about the standards with you today is because they are based off of the Strengthening Families approach and the protective factors, as well as the 9 principles of family support that were developed by Family Support America. So these are the 2 frameworks on which the standards are based. So what you see is these standards help show us how to work with families in quality ways to support families to build those 5 protective factors that you all know are so critically important. Right. And also important to mention up front that we are not selling the standards. The standards are free. So very intentionally want to make sure that everyone can think about quality work with families. And so the standards and all the implementation tools are available for free download on the National Network website. So by accessing that link there, or just going to the webpage and looking for the standards tab, you can find the standards and register and download them there, along with all the implementation materials. Right. And in terms of application of the standards, I mentioned that the standards are designed to be used by all stakeholders. So that includes family support and strengthening programs. So programs can use them as a blueprint for implementing best practice, for self-assessment, and to demonstrate the quality of their work. So they may already know that they're doing good work with families, but now by having national standards, they can benchmark against them to then show this as a further measure of the quality of their work. They can be used by direct service staff to help them reflect on and enhance their work with families. They can be used by networks of family strengthening and support providers for quality assurance, training, and technical assistance. And they may also choose to adopt them for membership expectations as well. Policymakers can endorse the standards for application in their area of influence. So this is something we've seen has been really helpful in certain places. I used to work in San Francisco, where I always pointed to a very clear before and after in terms of our working with the standards in relation to our elected officials. I will tell you that I'm not sure our elected officials cared so much what was in the standards, but the fact that we had standards meant something to them. So this is a big move forward for our field of family support and strengthening work, where now we can claim standards that we're all working off of. Funders can use the standards by integrating them into requests for proposals, monitoring, and quality assurance. And families themselves can use the standards partnering with programs to implement them, which you'll see is an important component of how the standards are implemented. And they can also provide feedback for how well the programs are doing in terms of implementing the standards. And we have a particular tool for that as well. All right, next slide. And at the program level, so for a program implementing the standards, it's important to understand that the standards are not something that the director of a program could implement by herself, or someone working as a family support counselor could implement by himself working with families. They're designed for the whole program team to be working together. So management staff, direct service staff, parent leaders, the families themselves. You want everybody all on the same page about advancing this work. And as you review the standards, you'll see the very way they're written in such a way you would need everybody on board to implement them effectively. Next slide. Right, and with that, we'll turn things over to Julie, who will now walk you through more about the standards in detail.
Okay, so on the screen here, you'll see the 5 sections of the standards that the standards of quality are divided into. So we have family centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. So as Andrew had mentioned, we recently underwent a review and revision process that really looked at all of these 5 sections with an eye towards diversity, equity, and inclusion. So in addition to updating the name of the Embracing Diversity section to the Diversity, Equity, and Inclusion, you'll see that the standards have really, diversity, equity, and inclusion has really been infused throughout the standards. And looking at the structure of the standards, we have, so there's 15 standards total, and then each standard has 1 to 2 sets of indicators of both foundational quality as well as high quality. And so the foundational quality indicators demonstrate the basic application of the standard. And then from that, the programs build upon foundational quality indicators to achieve high quality indicators, which represents deeper integration into the standards. And so each indicator is followed by 2 to 4 examples from the field that illustrate its application. And so these examples are provided as illustrators that are not meant to be a checklist or limited to the one-sided. In the certification trainings on the standards, a significant focus is on the participants thinking of their own examples that demonstrate the indicators in ways relevant to their programs. And as programs are applying the standards, they are encouraged to identify their own examples that demonstrate the indicators in ways that are relevant to their own communities. Here you'll see on the screen a little bit more detail about foundational and high quality. So again, that foundational quality is creating a solid foundation for the program. And the foundational quality indicators are met within those basic resources of a family strengthening and support program. And then the high quality, that's built upon the foundational quality being in place first. So this is what we encourage programs to strive for in order to meet the needs of the families most effectively. And the high quality indicators also may require some additional capacity building and investment. And then also important to mention that implementing the standards, it's very much a developmental process. So it's common for programs to see different aspects of their work along different points along the quality continuum, which you see at the bottom. So as you'll see at the bottom, we start with foundational quality not yet addressed, and then we are approaching high quality, approaching foundational quality, then we're meeting foundational quality, and then we're meeting foundational quality and approaching high quality, and then it continues. And you'll see that arrow continues even after we've met both foundational and high quality, because continuous quality improvements, it always continues to go. And here on your screen, this you'll see this arrow. This demonstrates the movement from foundational to high quality. And this is the arrow that we use to demonstrate that in the first 4 sections of the standards. So we see formal structure and staff training, as well as family partnership to move us from foundational to high quality in those first 4 sections. And on your screen here, this is an actual standard and indicator pair from the standard. So this is from the family centeredness section. And the standard is that the program encourages families to participate in program development and implementation. And then you see the foundational quality indicator on the left. So the indicator here is that the program solicits input from families to shape and plan the program and services. And then to move from foundational to high quality, we add formal structure and family partnership. And then the high quality indicator is that the program's design supports partnering with families to have an active role in the development and implementation of the program. And then this arrow is the arrow that we use to move us from foundational to high quality in the 5th section, which is the evaluation section. So we're moving from foundational to high quality by adding data analysis, sharing evaluation results, and or program modification. So with this arrow element, it may be one of them, it may be all of them, but it's at least one of them that moves us from foundational to high quality. And then want to talk a little bit more about training and what opportunities are available in regards to training. So training is a fundamental strategy for implementing the standards most effectively. And certification trainings, these are offered currently all virtual, hoping to get back to in-person sooner rather than later, but currently they are all virtual. And these trainings are designed for all staff, so whether management, direct service staff, as well as funders. And participants receive a certificate that is valid for 2 years from the date that they're trained. And these certification trainings are offered by pairs of trained trainers from member networks of the National Family Support Network. So networks, funders, other stakeholders can also contract with the national network to host a certification training for programs in their area if there are not standards trainers in their state yet. And programs are highly encouraged to come as teams of both management and direct service staff to the training, because successful application of the standards requires the commitment and the support of all levels of program responsibility. And with this standards trainings, individuals are certified, so not organization. And this ensures that the standards are infused in everyone's daily work and provides greater penetration into the program, as well as provides a professional credential to the staff. And all trainings are live, whether virtual or in person, because of the group work and how important that is, as well as the peer sharing being so valuable to the process of learning about the standards. And then the Training of Trainer Institute is a 4-day in-person or a 5-day virtual training for representatives of the National Family Support Network member networks to be able to conduct the certification training in their area. So only network representatives are trained to be trainers because this supports their capacity building and establishes a unique, essential, and ongoing role for them within their system of care in their areas. And also would like to mention that many network trainers are also protective factor trainers. So these trainers were trained by the Alliance. So want to flag that as well too. Here on this map, this is the current movement of the standards to date across the country. So you'll see here the states that are blue, colored in blue here, are where standards certification trainings have taken place. And then you'll see that we're approaching 10,000 individuals being certified on the standards. So really excited to hit that this year. And we have over 150 trainers that are offering these across the country. So you'll see there's also here the evaluation scores, overall satisfaction, and the readiness to implement the standards as well. And so training is rated very highly, and these are the numbers since May 2012. So really exciting to see the growth of the standards. And speaking of impact of the standards, here are some statistics about what post-certification training surveys have shown. So 91% of respondents, so folks that have been certified on the standards that replied, they said that the standards did enhance their program's work with families. And then of those that responded, at least 85% of them are using at least one or more of the standards implementation tools. So really excited that they're using those and they are impacting their work effectively. So speaking of the certification trainings, we, in addition to going to the website to see if there are trainings offered in your state, you also can participate in an upcoming virtual open training that we have at the end of the month, this month. So registration is available on the NFSN website, and it's filling up, but there's still room. So be sure to check out the certification training page. So if you go to nationalfamilysupportnetwork.org and you click on the standards of quality at the top and drop down to certification trainings, you'll be able to find the registration for this training as well as see what might be offered in your state. All right, so now we focus in on looking at standards implementation. And with that, very excited to turn things over to Chris Watkins here in upstate New York. She's the coordinator for the Jenny Mose Family Resource Center.
Thank you, Julie. As Julie mentioned, I am Chris Watkins and I'm from upstate New York, and I am the coordinator of the Jenny Mose Family Resource Center. And I am here to talk about our experience in implementing the standards of quality at the program level. So my program is actually housed under our agency ProAction of Steuben and Yates. So ProAction of Steuben and Yates is a community action agency who was founded in 1965 to address poverty. There are over 1,100 community action agencies across the country. ProAction houses multiple programs, all of which are resilient and trauma informed with a focus on equity and diversity. Next slide. There are 4 pillars of programs to support the mission of ProAction. Our program, Community-Based Services, is represented under the Resilient Children and Families pillar, highlighted here in blue. Next slide. So I have been the coordinator of the Family Resource Center for over 23 years. The foundation of our work with families is rooted in the Strengthening Families Protective Factors framework, family support principles, and the standards of quality for family strengthening and support. We use a strength-based 2-generational approach to build resilience and promote healthy child and family development. You see there are some activities we have going on. Just some of what we offer, but not all. Utilizing the program implementation continuum tool is an integral part of the implementing the standards of quality for family strengthening and support. I will provide an overview of our journey of implementing the standards of quality and go into more detail with each step along the program continuum. To prepare to implement the standards, the New York State Office of Children and Family Services and the New York State Family Resource Center Network presented a standards overview training provided by the national network at a regional FRC meeting. We reviewed information about the standards on the NFSN website, and as a result, the New York State FRC network adopted the standards of quality and became a member of the NFSN. Plans for implementation across our state network were made to move the work forward. Our ProAction program then shared the program implementation continuum and the standards overview with other stakeholders, including our board of directors and community partners involved in our work. As a team, we reviewed and discussed our plan of next steps to implement the standards of quality. Next slide. In September of 2016, you see Julie here, 5 of our staff were identified to receive the initial standards of quality certification provided by the National Family Support Network, including myself. The following month, 3 of our staff attended the training of trainers for the standards, and in January, we held our first local standards training, which included the rest of our direct service staff, our supervisor, and other community partners. We recertify every 2 years. At the time we were trained on the standards, we were part of the Family Enrichment Collaborative, which consisted of 3 FRCs, Family Resource Centers, home visiting program, and another FRC overseen by a community partner. Together, our collaboration created a plan and timeline for completing the program self-assessment tool. Each of us completed a self-assessment within our individual programs because, as Andrew often says, if you've seen one FRC, you've seen one FRC. We then used a summary tool to collate scores in SurveyMonkey to get a weighted average from each of the self-assessments. This allowed us to identify which standards we wanted to work on across the collaboration. We focused on 3 of the standards over the next year. Simultaneously, we moved the participant survey tool to add, we modified, the participant survey tool to add additional information required for another funder, so families would only be asked to complete 1 survey, for which they very much appreciated. Next slide. To develop a program implementation plan, we hosted a parent cafe on the standards to engage stakeholders in reviewing data and have a meaningful conversation to dig deeper into the standards self-assessment. This included 5 parents from across the county and staff. Parents were very invested in the process, including a parent who had taken 2 buses to get to the event. As a result, we created a standards of quality action plan based on the entire process using self-assessments, participant surveys, and the harvest from the cafe. We then presented our standards action plan and discussed the process at a quarterly New York State FRC network meeting. So as you can see, it's just really a continued process. Thank you, Julie. To ensure ongoing quality improvement, we held program meetings focused on this particular section of the standards and the need to move forward towards high quality by creating a formal structure and family partnership. We identified that we would like to have parents represented on a coalition, which is called Kids on Track, and a need for a working advisory committee, which included parents. Our program reports to stakeholders on our standards implementation action plan process through quarterly reports, and we identify the need for additional training for staff and parent leaders. As a result, the New York State Network invited the National Family Support Network to present their training on developing and sustaining parent advisory committees. We recently completed a family leadership training and have created a formal structure to provide ongoing training and supports for parent leaders. We also complete an annual self-assessment and participant survey to develop a new action plan, with our last one taking place in July of 2020. Within this process, we modify our program and train new staff as needed. Next slide, thank you. We take a deeper dive into the 5 sections of the standards with additional trainings through New York State Member Network, ProAction Professional Development, and the NFSN website, or webinar Wednesdays, excuse me. Some examples of these include a protective factor training hosted by ProAction and presented by Prevent Child Abuse New York, a New York State Parent Education Partnership Strong Roots Conference, Creating Culturally Responsible Community, hosted by ProAction of Steuben and Yates, in which there was a panel presentation with community members to speak on the issues facing individuals and community agencies in dealing effectively with cultural differences and equity when working together. A New York State Birth of 5 Parent Leadership Conference on Capacity, Connections, and Collective Action, where one of our parent leaders was on the organization committee and spoke at the event. Currently, the New York State Network facilitates a member call, which includes a discussion on specific standards monthly to support shared learning. The Standards of Quality for Family Strengthening Support provided a framework for our program to really improve quality while delivering services to families and children. The self-assessment process gave us the ability to look at the work we have done in a more comprehensive way, celebrate accomplishments, and plan for the upcoming year. The process also provides an opportunity for team building, professional development of staff as you move along the continuum of quality. The benefits of this are, it's more of a focused intention on standards, which then improves program quality. Example of this is increased parent leadership. What you focus on, you get more of. Increased participation of parents in leadership activities, program planning, and delivery and advocacy. Some examples of this are community cafes, NFSN member convening and national forum attendance, briefing on Capitol Hill, parents planning and delivering programs at FRCs, examples like Parent Share, Be the One, trained in parent education programs such as Flip It, community events, literacy events, resilience screenings, participation in professional development offerings, speaking at conferences, panel presentation, and co-led activities. Obviously, during COVID-19, we have all faced many challenges, but we have also been able to move our work forward in implementing quality programming for families and children by completing the Standards of Quality self-assessment in July 2020. But, you know, it really does take a lot. And so the lessons and the challenges that we have learned is that it really does take buy-in from the top, but the work starts at the bottom. It does take time and planning to truly implement the Standards of Quality, make it a priority. It's not something that does happen overnight. Work together and make it work for your program. Don't try to do everything at once. Break it down into manageable pieces. Involve parents by providing support, childcare, transportation, and stipends when it's all possible. Take time to celebrate your accomplishments. Be kind to yourself and each other in the process. And enjoy the journey. Quality is a continuing process and journey.
Thank you so much, Chris. And here's Chris's contact information if you'd like to reach out to her. She has been in the field and doing this for quite a while, so she is an amazing resource to have on hand. And with that, introduce to you Barb and Debbie from Utah Family Strengthening Network. Without further ado.
Okay, I guess we're on, Deb. We were asked to talk about the systems level, and we will tell you that it's been an interesting and unusual journey, but we're seeing more and more changes, and we finally have found a landing place for our network, which we think will be sustainable from here on. And we have changed the name to the Utah Family Strengthening Network. And actually one of our associates that's on here today, Donette, is our new chair of our network. So we're excited to have her on the call and excited to move forward. We'd like to share a little bit about our history because we kind of adapted the standards after we adapted the protective factors. So if you'll advance the slide, I'm going to show you where we came from and then now where we're at. So about 2014, we decided to develop a Strengthening Families Leadership, and we adapted the name of Protective Factors for Utah Families. And the reason we did that was because the protective factors had been introduced to our state Child Abuse and Neglect Council, and they were very, very impressed and wanted to adapt it. And so because of that, our Child Welfare Department brought in the national team of trainers from Protective Factors. And in June of 2013, we had maybe 6 or 7, I think, individuals from Utah that were trained, and they were heavily in child welfare and prevention. And so we had kind of a core group that began the process. But that core group, especially us who worked in prevention, decided that we loved the aspect of the parent partnership. And that was where we really felt like we could begin the work. And so we started working and convening parents from all over the state for almost 3 years. And our parents developed a model for a parent advocacy council. And that was kind of the beginning of some of the work that we did with Protective Factors. So we had these parents who were actively involved. They were excited and they wanted to be involved. And so then the opportunity came to have more trainers trained in the protective factors. And so in May of 2016, we had 22 additional trainers brought on and trained in Utah. And 6 of those 22 were parents who were able to do the training. And they were really excited to get going. I want to say that actually, it was before the 2016, that little core group trained over 400 people in protective factors. And those parents, before they were even trained in the protective factors, trained over 70 parents in community cafes. So the parents were really the driving force, I think, initially in our protective factors. But then as a system, we could see the alignment, not only in early childhood, but across child welfare prevention, within the resiliency and the trauma-informed group that was in our state, that all of this was kind of aligning. So then at that point, we adapted different versions of the training. We had a professor in Utah who developed a parent piece to it. And so our trainers were trained in multiple versions of the protective factors so that we were able to offer options to entities and get them trained. So I'll turn it over to Deb. You're muted, Deb.
Is that better?
Much better.
Okay, go ahead and go to the next slide. So we knew that in developing our network, as it said on the previous slide, that we kind of had to start with where we were at. And you know, in building a network, there are a lot of different moving parts at the same time. Everyone on the state is working on the things that they believe are the most important, and of course they are, but getting some alignment between all of those efforts as a network is a little bit difficult to do. So in building our network, we decided that we needed an infrastructure that we could rely on, and that's where we developed some leadership. And we all did this pretty much voluntarily. We just felt like this was the right thing to do in Utah. We knew we needed to deepen the knowledge and understanding primarily of the protective factors, because that's where the state of Utah was. There was already a great investment. Now, keep in mind, I already knew about the standards and wanted to work on implementing the standards, but Utah was just not ready to be there yet. There was a lot of effort sunk into protective factors, so that's where we started. We also knew that because we had buy-in with the protective factors, we could ensure some accountability to the trainings that we were offering. The parent partnerships were solid. As Barbara mentioned, there were so many efforts in place to get parents involved. They were very excited about learning about the protective factors and how to include them in their families. Our ultimate goal was to begin to shift our practices and policies in the state of Utah, and that became easier as we developed common language about the things that we did. Okay, go ahead and go to the next slide. Barb, do you want to go ahead and talk about this one?
Yeah, so basically, once Deb had joined our Child Welfare Improvement Committee, it transformed from our CAN Council to our Child Welfare Improvement Committee quick. Once she joined that, and we learned more and more about the standards, and then Andrew came out and visited with our head of prevention under our Child Welfare Administration, and then we also started seeing that to implement the infrastructure and to really shift policy, that the standards were such a beautiful fit to what we were doing, and that our work in the protective factors really laid the foundation for people to understand the standards better and to implement them better. So when Andrew came to visit us, that's when we determined that, yes, we're going to implement the standards also. And so out of that came more trainings, and brought in some trainers to train our 2 initial groups of, I think it was about 60 people, and it was across every entity. It was family resource centers, but it was also, we had the United Ways participated in it. We had Head Start. We had, I'm trying to think of the variety. It was a few years ago. And people were really excited with the concrete tools that were available in the standards. And so we determined this was a great way for us to go and create and strengthen our protective factors state leadership with the standard state leadership and the network. So out of that, after that training, we had, again, some trainers that were trained within our state. 5 of us were trained and in a position where we could begin to train other entities that were requesting it on an ongoing basis. And then within about 8 months, COVID hit.
Right.
Everything exploded. Yes. But before that happened, we had determined that our network would be called the Protective Factors for Utah Families. And as you can see, this was our initial attempt at building an understanding, a visual understanding of the road of progression that an organization could make. First awareness, then implementation of the protective factors, then awareness and implementation of the standards, and then the embedding, in other words, going very deeply and becoming a member of the network so that they were continually looking at quality improvement in both the protective factors and in the standards. I realize the protective factors come under the standards, but we came from that angle.
Yes, right.
Do you want to add in there, Deb?
I just want to point out that on this graph that we built, because it was a good visual to help people understand the progression, we had the standards continuum and we had the programs continuum, but no one had really been trained on the standards yet, and we had to sort of build off the 5 protective factors. Along came something else too that became important that we incorporate, and that was the social determinants of health. And so as each of these pieces became more and more important, we realized that we had to help families and to help organizations that were being trained how these things fit in or made sense with the 5 protective factors and then ultimately the standards. And it wasn't too hard to do, but we had to be very cognizant of that and keep adding on layers so that we were, again, all speaking the same language.
And I'm glad that you mentioned that, Deb, because I think what we have learned is that, and I'm sure you're seeing this in each of your states, that there's a lot of grassroots and also state level work that's happening in silos and raising the level of awareness, whether it's ACEs or it's trauma informed or it's resilience or it's social determinants of health. And so what we learned through this process was that we have tools that can help you implement whatever your end goal is. This is still a means of getting there by incorporating these 2 very strong well thought out concrete frameworks. And so our messaging, we've had a lot of discussions of how do we message this to early care providers? How do we message this to whoever? And how do we embed it in their system and embed the standard certification in this system? So it's really learning how to message it and communicate it and really meld it with what is currently happening in the state and make it more apropos to what they're doing.
Mm-hmm.
The next slide, if you want to continue, this is kind of the history again, but again, it kind of shows that it took us a while to do this. I mean, we're talking about like 2012 to 2021. So, and we're still just really beginning the process. We now have the 5 trainers and we're able to train in the state, and we've done a couple of virtual, actually 2 or 3 virtual trainings, but we are now at a point where we're ready to be at the call of different entities that would like to incorporate this into their system. So the reason why we included this is we wanted you to see that it's a long journey to get here. And the way that we began the journey was with our love and adaptation of the protective factors.
Again, it just showed where we had to start at a certain level. But what it meant is that when people came to the table to learn about the standards, the minute that we started talking about the 5 protective factors, you could see all heads nodding like, oh yeah, we know where we are. We get this. Show us more with these standards so that now we know how to implement this next layer. Okay, go to the next slide. Yeah.
And this just shows that we started with the 5 protective factors and we started with those 5 core functions. And we knew that they needed to be strengthened. And it was the standards that allowed us to really strengthen that and make it a much more effective system to be able to sell to our state and to other entities that are looking to really improve the quality of services to parents. And I just want to add in here, I've used both assessment tools, both the 5 protective factors and also the standard, and I have learned so much about the organizations that I oversee just using those tools. And here's our contact information. You can email us anytime. Deb and I work a lot at nights. And we are very happy to answer any questions and take you through more detail.
And from a systems component, Barb mentioned that we recently changed our name to from the 5 protective factors network because we realized we had now expanded what we were talking about because we wanted to include the standards. And the other piece that we did to help with sustainability is that we merged with a nonprofit organization because we were not in a position to become a nonprofit yet. So a kind of a host entity was Prevent Child Abuse Utah, which was a nice fit for us. And so now we have some sustainability aspects to support us in moving this effort forward.
Thank you all so much. This has been wonderful presentations. And I think what I'm going to try to do, I'm going to encourage people, if you have a question, type it in. I haven't seen any questions come through so far. So we are open for questions, and I invite you to type in, or if you'd like to speak, unmute yourself and jump in. I'm trying to spotlight everybody who might answer the questions.
So I have a question, and I unmuted myself. I'm Becky Mather, and I'm from Wisconsin. Hello to everybody on there that I have met or run into.
Hi, Becky.
And hi, and I have a quick question for Chris from New York. I'd like just a little bit more detail if you could share with us. You showed that you did a parent cafe with parents pretty early to sort of start in the beginning of the structure to get them involved, and I love that. So tell us a little bit more about that.
So that really, thank you for the question. So that really just seemed like a natural progression for us because we had been doing parent cafes probably a year prior to that. So it just, we were excited to see that was included in the implementation. Well, it wasn't really, but really that strong parent piece. So it just really seemed natural. I mean, we're talking about families and working alongside families. Why wouldn't we not want them to be part of that conversation? So a cafe just seems so natural for us to do that. And so we had parents alongside us, just developing some of the questions and then helping us facilitate that conversation, that cafe.
Wonderful. Thanks, Chris, and thanks for that question, Becky.
Thank you.
I see a question from Mary Ellen Santiago asking, would love to know what organizations in California and Massachusetts are implementing these standards, looking for programs to refer youth and families to quality programs.
And I don't have to get the list today, but if someone can email it to me, I would love to have a resource list of where to refer our families to.
And actually, maybe Andrew or Julie, could you share a little bit about when a state is a member of the NFSN? Do you then have information about which programs are using the standards in that state, or would you just be referring Mary Ellen or someone else who's asking to the network lead in the state?
Yeah, we would probably be referring you to the network lead in your state. So we do have a record of everyone who's been certified on the standards because the national network issues those certificates. However, that's, as Julie mentioned, more than 9,600 people. So that's a lot of data. In Massachusetts, the lead for the Massachusetts network is the Children's Trust. And so the Children's Trust has had 5 trainings to date, trained over 100 folks, and so they would know who the people are there that are certified. In California, there are many trainers, so the training has happened all over the state, and there are lots and lots of people and programs that are trained, and there are soon to be more with the different entities in California planning to further roll this out, including, I want to acknowledge Jennifer is here from Caltrin, which is an organization in California planning to do more with the standards to ensure that they help bring everyone on the same page, again, with quality work, which is really helpful in a state with lots and lots of programs.
Thank you so much.
All right. I see a question about whether there's a cost to attend the Train the Trainer. So someone had asked earlier in the chat, and I saw Andrew responded that for a program to get certified by a trainer who's already in your state, it depends on how the state is offering that, but is a pretty low cost training. But can you share about the training to get certified as a trainer?
Sure. So first of all, the information all about that program is on the website too. So when you go to the website, you'll see a standards section, and there's a drop-down menu, and there's lots of tabs with lots of information about particular things, such as the training, the implementation tools, the Trainer Institute, etc. So I'll just quickly mention some information, but you can find a lot more there. The first thing that's really important to mention up front is that, as I mentioned, the mission of the National Network is to support these networks of family resource centers, as well as to promote quality work with families. So it's this twofold mission. So that connects with what I'm about to say about the Trainer program, because that isn't to train anybody to be trainers. We only train representatives of our member networks to be trainers. So you have to be connected with a member network in order to become a trainer on the standards. That's intentional because that helps support the development of these networks. We want to support their capacity to be the go-tos for this training in their states. So intentionally, we didn't hire 50 trainers to go across the country and do this training. It's all about supporting the local capacity to be able to provide that and build that system of strong support for families in their area. So the first thing to think about in terms of if you were thinking about becoming a trainer is, are you connected with one of our network members, and that they would support you to become a trainer in their state.
Okay, thank you. I don't see any other questions coming in. I see some folks have shared other resources in the chat, so keep an eye on that, look through and see what else has been shared. But I don't see any other specific questions. I think what I'll do now is thank you all for presenting. This has been really, really helpful. And I'm gonna move us into breakout rooms. Anyone want to share something you learned from your small group discussion? If not, that's all right.
I will ask a question if that's okay, because I was unsure how to answer this. I had somebody ask how closely aligned the standards are with the COA, that their state requires that. And I had not heard of that and was not sure what that was. So if there's anybody that can answer, that would be great.
Yeah, so COA is standing for Council on Accreditation, and the COA is a whole nother system, a whole nother process that isn't connected or mapped to the standards at this time. So the standards, as Julie referenced earlier, are intentionally granular in terms of when people take the certification training, they received an individual certificate for the training, and that's intentional for two reasons. One is because we want to implement those standards, you need everybody to understand them. That's number one. And two is because we want to create this credential for folks that goes with them with their future work in the field, which is different than accreditation, where you're accrediting an organization, putting a stamp on it saying these folks are a quality program, which is also wonderful, but we don't do that with the standards, in part because, you put a stamp on an organization, say this is a great program. A year later, the staff have moved on, the people who were trained. So is it really the same program? So that's why we chose to go the route of the granular certification as opposed to the overall accreditation process that some other processes use.
Thanks, Andrew.
Thank
Very
you,
good
Andrew,
answer.
very much.
Okay, I think we're going to jump to Lucretia and Martha, who are going to share some updates from the Alliance, and then I'll share some from CSSP and we'll wrap up.
Hey everyone, it's really great to be with you this afternoon, and always good to see familiar faces and new faces. And I think I've always said it's great to be with Protective Factor people anytime. And thank you, Andrew, and all of those who presented today. Wonderful information and good to be part of this conversation. So real quickly, I have today with me Lucretia Rose, who is the ANPPC co-chair, and I'm going to give you a little bit of update about the Alliance training of trainers. Like a lot of you, know that this year has been challenging for training, and we've been doing ours virtually, and we have it's been quite a ride. Our lead trainer, Maureen Holliker, is on the call today. Hi, Maureen. Can you give us a wave and say hello? Maureen has done an amazing job and a wonderful job, and we have just kind of saved the date for some upcoming quarterly trainings. We've had one in February. We have one later this month, but the registration is closed for that one. And we have two more coming up, one in September and one in December. The registrations are not available at this time, but they will be by next month, I'm hoping. And if you need more information, please, there's my contact information. Just a reminder that we have an online training that is free and also available for a small fee for CEUs. And if you want to just get some baseline information about the protective factors, and it's a wonderful training. It's reached so many different people. And I just wanted to share that information with you as well. And I'm very excited today to turn it over to Lucretia and have her share some materials around the social emotional competence of children that our Alliance National Parent Partnership has developed for Child Abuse Prevention Month.
Thanks, Martha. Hello, everybody. My name is Lucretia Rose. I'm from West Virginia, and I am the co-chair of the Alliance National Partnership Council. And I'm also a part of the national training team for the Protective Factor. So I feel right with my people. And I heard Barb talking about some tools today, and Andrew talking about standards and tools and the Protective Factors framework. And so our messaging goes right along with that. And I'm really excited to share with you the ANPPC's materials for Child Abuse, Neglect, and Prevention Month. And so I'm going to share a different screen here. Let me get out of my PowerPoint. And I'm just going to take you straight to the website. So if you go to the Alliance website, this is what you will see. And at the top of the website, you will see it says Hero Toolkits for April. And when you click on that, it will take you to the Parent Voice page. When you get to the top of the Parent Voice page, you'll scroll down and you'll see our materials that the ANPPC
let me just,
has.
I'm on the Strengthening Families call, but the important stuff is over.
Sorry, here, let me mute that. Okay.
To ask someone to mute themselves. Thank you.
I think I got it. Okay. Anyways, you scroll down to the April materials, and you know, as I heard people talking about, particularly Barb talking about toolkits, you know, families have their own toolkits. Parents have their own toolkits in ways that have strategies in their toolbox to help them navigate the successes and challenges of raising a pandemic or raising a family, especially during a pandemic. You know, this last year has really had us reaching for tools that we might not even know that we even had down in that toolbox. You know, we've really been tested. Our strategies as parents and families have been tested. And so the Alliance National Parent Partnership Council wanted to really help families find different tools specifically in how to promote their children's social and emotional competence. So each week, we developed a campaign called the Hero Campaign. And so we're continuing the Hero Campaign from our February work to highlight heroes, especially parents, in their.
I think she's experiencing some connected issues.
Can you hear me?
Yeah, I can hear you now, dear.
Sorry. Each week we will debut a new mini toolkit, and each toolkit is based around one of the everyday actions from the Protective Factors logic model. As you'll see here, the healthy is to model nurturing support to children, and then it goes on down. I was really excited to show you today a clip from next week. So you're fresh off the press. No one has seen week 2's video, and I'm going to share it with you today. So just click here. And this is from one of our members, Edward, and he is interviewing one of our members, Lachey, specifically about celebrating her child's uniqueness.
It's National Parent Partnership Council. We are continuing to celebrate parents as heroes and acknowledging that many ways that families are helping their children and themselves manage all the emotions that come in the day-to-day and throughout this pandemic. And with me is Lachey. And Lachey, I wanted to ask you, what tools do you find yourself reaching for when you are helping your child celebrate their uniqueness of themselves and others?
Thank you, Edward. Yes, this is a very interesting question and very, focused uniqueness for my daughter. Due to an accident in 1998, she survived a traumatic brain injury. And so her uniqueness has different layers to it. And I think as we may shop for different toys or are out in the community, always pointing out others' uniqueness and not making her disability or wheelchair use or even communications device use unique, but this is the way you walk around, this is the way you speak, and what tools do you use? And as I even train staff of her body does the same things, they just do them differently, and explain that to other children and allow children to ask questions about any person in a wheelchair and answer their questions versus be quiet, don't ask questions, and don't stare, but be able to give other young people space to ask questions and to remain curious. And so we celebrate maybe nights that she may not be screaming because of her brain injury, and we celebrate the screaming. So we all support the team, myself and the roommates all support it, because we don't, society sometimes does not make it easy for people to experience their emotions. Depends on what those emotions are on the spectrum. And we accept happiness, joy, peace, quiet, but we slap down screaming or anger or you're being quote unquote bad. And so it's about where is any person on the spectrum of emotion, and just supporting that, and what resources and support does that individual need. So that was a long answer, but
Wow.
So you can go to the website and feature videos and activities and lots of different things each week in those mini toolkits. And I hope that you use it. They're for parents, by parents, in hopes that you can help your families and your programs grow their toolbox this month. Thank you.
Great, thank you so much. All right, I'm going to show my screen for a last few updates from CSSP. Just about a couple other things that we've released recently that you might find interesting. One is a new podcast that we've put out. I shouldn't say new podcast. This is the only time we've put out a podcast, hopefully not the last. It's called The New Neighborhood. It's hosted by Joan Lombardi, and she is interviewing different people about innovative work they're doing that's really at the community level and community systems level. So the most recent episode, there are 3 out so far. The third one is about the project that we shared on our January webinar as well. That was a partnership between early childhood development folks and community development and housing people in 5 different communities. So on the webinar, you heard from 2 of the partners that had been involved in that work, and this podcast interviews folks in Boston, which is another community you didn't get to hear a lot about on the webinar. So I encourage you to check that out and stay tuned. I believe we have 6 episodes planned, and hopefully we'll do more podcasts in the future. Also wanted to share a recent release from our policy team supporting the first 1,000 days of a child's life, an anti-racist blueprint for early childhood well-being and child welfare prevention. This builds off of earlier work that we did with an anti-racist early childhood policy agenda and gets into more specifics of a blueprint. So I encourage you to check that out. They also did a webinar on that, which I also have linked on the slide. I know you can't click on the link, but we will send out the slides, or they'll be posted along with the recording of the webinar. Or you could just go to cssp.org, and all of these things are featured prominently because they're new. And last but not least, I wanted to share another recent publication which relates to the webinar we'll do in May, the American Rescue Plan's Child Tax Credit, Advancing Equity and Laying the Foundation for a Child Allowance. So this is from Elisa Meinhoff on our policy team, who will be one of the presenters in our May webinar, and we'll be sharing more detail about how you can help make sure that families are able to access that child tax credit in your communities and states, and about some of the ongoing advocacy to make that a permanent child allowance for all families in the US. So I encourage you to check that out and tune in May for our next webinar. And with that, we are at the end of our time. I want to thank you all for joining us. This has been a wonderful discussion. Many thanks to our presenters, all of them. There were many and all had something really interesting to share. And thanks to all our participants for joining and jumping into the conversation. Thanks, everybody. Enjoy the rest of your day, and we'll talk soon.